Hello everyone, welcome to physioBRAIN. This is Professor Adriano, and today we're going to talk about an essential topic: how to identify and what are the symptoms that precede a stroke. So before we start talking about this, subscribe to our channel, like the video, share it with anyone you think needs to see this, and let's spread this health information. So before we explain these symptoms and these changes, the signs that the body sends when we are very close to or actually having a stroke, it's essential that we understand what a stroke is, right? A stroke is called a cerebrovascular accident or encephalic vascular accident, which is the more technical term, more commonly used in the medical field and in healthcare in general. It is a medical incident or event in which there is an occlusion, that is a blockage or a rupture of a vein or an artery, meaning some type of blood vessel within the human body that ultimately affects a certain specific region of the brain. So the affected region where the rupture or bleeding occurs in that area can suffer damage impacting that specific part of the brain, right? In a very quick and general way, that's it. So a region of the brain is affected because of a cardiovascular event. It's very interesting to consider that a cardiovascular event happens in a brain region, which leads to a neurological situation and has repercussions on the muscular and skeletal or musculoskeletal system. So we can see that this is a highly significant factor, right? As it is one of the main causes of death worldwide and one of the leading causes of comorbidity. So we can be left with many after effects resulting from a cerebrovascular or cerebral accident, all right? So let's pay close attention to being aware of the risk factors, being alert to how we can prevent these signs and symptoms, right? And always keep our health levels in check. All right, everyone? So some signs that we can look out for when a stroke is happening, is about to happen, or is occurring. One of them is tingling on one side of the body, right? So it's very common for a person to feel tingling, pain on the left side of the body, so the left arm becomes weaker, it tingles, and the person feels like they can move it with strength or precision. So this is a very classic sign: chest pain on the left side, tingling on the left side of the body, especially the left arm. So this is a very classic sign of a stroke. Another sign is difficulty speaking, right? The person can't say a word clearly, you know? They have trouble processing and getting that word, that sentence out in the correct way, right? The person has tremendous difficulty when trying to speak. So if if you suspect that you or someone you know is having one, ask them to speak clearly, okay? If they can't do it, you should call the health service right away. Contact the nearest health service, all right? Another change we can observe is an altered level of consciousness, right? Or changes in vision. The person may have a sudden loss of vision or a sudden loss of consciousness, okay? So let's pay close attention to these signs, all right? The person may lose their balance. They might be walking or standing and suddenly feel dizzy to the point of almost falling or actually falling, right? So we need to be alert to these signs as well. Along with that, right, speech difficulties, which we already mentioned, and mental confusion, okay? The person can't orient themselves, can't state basic information, can't say their name, can't say their age or where they are. So mental confusion is also a very classic and characteristic sign of someone having a stroke, right? Knowing these main symptoms that we can find in scientific references, many doctors advise the scientific community is very clear that these are the characteristic signs of a stroke. So pay attention to your family members and to yourself. If you have a predisposition to any cardiovascular disease, if you have hypertension or any type of condition that is not under control, be alert to this, okay? Let's not be careless, let's stay vigilant so that we can preserve our quality of life as well as that of our family members and those close to us, all right? So I hope you enjoyed the video, that it was clear and that it answered your questions. If you have any suggestions or anything else, write them in the comments section. Don't forget to subscribe to the channel, share the video and like it so that we can keep providing this quality and accessible information to the public. A hug, and I'll see you in the next videos.